A glossary of acupressure terms. Many of the terms used when discussing acupressure may be unfamiliar. Here is a brief explanation of some of the more common ones. Acupressure, an ancient healing art in which finger pressure is applied to specific sensitive points on the body. Acupuncture. This technique involves the insertion of small needles under the skin to activate the flow of Qi. Effective particularly as an aesthetic, acupuncture is not nearly as painful as it looks. Qi. According to traditional Oriental medicine, this is the body's vital force, also known as Qi in Japan and Prana in India. Meridians. These are the 14 pathways in the body through which Qi is believed to flow. Each meridian passes through many parts of the body. Moxibustion. Like acupressure and acupuncture, the aim here is directed to the tubos. Rather than using fingers or needles, the practitioner uses a small dollop of herb, which is ignited and generally allowed to burn down to the skin. Shatsu. Developed in Japan, this is a stylized method for manipulating the tubos, either through pressing with the fingers and hands or through the use of elbows, knees, and feet. There are various forms of shatsu. Tubos, points along the meridians where the energy flow may become blocked. Also known as acupressure or acupuncture points, manipulating the body's approximately 360 tubos is thought to release the flow of Qi.